Hello, thank you for joining us for ICAM's fourth International Conference on Humane Dog and Cat Population Management. My name is Alexandra Rothlisberger, and I am Director for Companion Animals and Engagement at Humane Society International. And today, we will be talking about the importance of access to care in dog and cat population management programs. In most of our programs around the world, we seek to build the capacity of local organizations and to provide them with the tools to be less reactive and more proactive in their approach to animal welfare. We engage the community to create a program based on the needs that the community itself identifies, and we empower community leaders and animal welfare advocates to become the face and voice of the program. We also accompany this process of community engagement with constant communication, meetings, workshops, and text messaging that reach everyone in the community, including, and sometimes most important, those people that do not have or do not like dogs and cats in their homes. We also approach local schools to better understand the knowledge and perception kids that live in these communities have of dogs and cats. For instance, in 2022, when we visited a school, a child came up to us and said, "Dogs don't have feelings. Dogs don't feel pain." So it is important that you know what perception kids have towards these animals to better inform your strategy in the future. Regarding stakeholder engagement, we meet with local government entities to learn about their capacity to run programs that improve the lives of dogs and cats and people in their communities. The success of all of these efforts in improving the welfare of animals ultimately depends on access to veterinary care. Why is access to care so important? The lack of veterinary services in communities suffering from systemic inequalities around the world is concerning. This is aggravated in rural areas that, in many instances, lack access to services of any kind. To put things into perspective, I will refer to a case study in Chile where a target area formed of communities situated in the Ovalle commune and around Fray Jorge National Park in Chile was selected for a model pilot project to effectively manage the population of dogs and cats, to reach herd immunity of certain zoonoses, and to protect the health of the public. All the while, this project indirectly seeks to impact the welfare of the park's wildlife by avoiding transmission of zoonotic diseases from dogs and cats to wildlife. In order to better understand the needs of the community and to guide our strategy, we invested resources in collecting field data that would also help measure the impact of our work. The data we collected showed an important number of households caring for dogs and cats and an understanding of having dogs and cats as companions. However, when asked about having taken their animal to a veterinarian before, 68% of households responded that they had not taken their animal to the vet, and only 29% said yes, their animal had been to a veterinarian. And over 89% responded that their animal was not vaccinated against rabies, even when dog bites are the highest ranked concern across the board, according to the survey. The main reason cited for people to not have their animals vaccinated was a lack of transportation to bring the animals to the veterinarian. Now that we have some insight into the needs of these communities, let's talk about the access to care in greater detail. In 1981, an article was published that looked into access as a general concept that summarizes a set of more specific dimensions, describing the fit between the patient, in our case, the guardian and their cat or dog, and the healthcare system. The specific dimensions are known as the 5 A's of access to care, and these should be considered when discussing the animal healthcare system as well. Affordability. How much funding do you have for your dog and cat management program? Availability. Are you investing specifically on spay-neuter, or are you able to expand to preventive services as needed by the community? In the example I gave you earlier, it was an accurate decision on our part to invest in the welfare of animals and people by providing preventive services above and beyond just spay-neuter. Accessibility. Will you be working out of a brick and mortar building, or will you be mobile and be able to transport your team, the equipment, the supplies to the community itself? Accommodation. Think about whether your team will be able to work outside of a regular schedule on the weekends or late into the evenings and use WhatsApp for texting instead of emailing. And last but not least, acceptability. This is a big one and one that is oftentimes overlooked. It is essential to gain the trust of the community. And for this, you need to have a charismatic person in your team, a true people person, someone who enjoys speaking with individuals without judging or being biased. They will be the face of your program, and this aspect alone can make or break your work. Most of the challenges that we see today in access to care relate to a global shortage of veterinarians and technicians, and this is especially true in rural areas. Many veterinary surgeons lack the skills to perform safe and high-quality spay-neuter, resulting in post-op complications and even the death of many animals during surgery. Another big challenge is systemic poverty, where issues have been aggravated by the absence of services for so long. And also the lack of capacity and know-how from governments and sometimes from local organizations. So given these challenges, how can we solve some of them? There are very few opportunities available for veterinarians to specialize in their area of interest around the world. Since 2014, HSI has been training veterinarians on high-quality spay-neuter, and to date, we have trained over 300 veterinarians, technicians, and veterinary students with personalized instruction. One-on-one training is indeed essential, and it needs to be followed up with mentorship to help these trainees implement their own low-cost spay-neuter projects in their own clinics or back in the government facilities where they're employed. We have examples of government-employed veterinary teams who return to their city to implement what they have learned with great success. And we have teams of independent veterinarians who, after training, are able to secure international funding to bring services to communities in the Amazon of Colombia, for example, as is the case of one group that we trained back in 2019. Ultimately, access to care needs to be sustainable, long-term, and lead to a change in behavior. Veterinary training helps with having more hands that are skilled to perform more surgeries and safer surgeries. But the sustainability of access to care depends largely on a multifaceted approach to a dog and cat welfare program. Those of us who have worked on human behavior change know that change happens over time. And this change happens when you consider access to care as a set of dimensions, where each one plays a role. It is not only about bringing a veterinary team to a community, but about all of these other considerations you need to have a strategy for. And once you consider all of the dimensions of access to care, you should also consider going back to the drawing board to build a holistic program that factors in community engagement, humane education, capacity building, stakeholder engagement, and build bridges between all of these efforts to create a more robust and successful dog and cat population management program. Thank you for being here today. I will be around to answer any questions you may have. Thank you.